Provide catheter care to a female resident who has an indwelling urinary catheter. The candidate is asked to provide catheter care to a female resident who has an indwelling urinary catheter. Soap and water should be used for catheter care. For testing purposes, only cleansing of the front perineal area and the catheter are evaluated. Cleansing of the rectal area and buttocks is not tested in this skill. A mannequin is used for the role of the resident, and you have 12 to 15 minutes for this skill. Good afternoon, I'm Joni. I'm your nurse aide today. What's your name? Marty? Nice to meet you, Marty. Marty, I'm here to provide catheter care, so I'm going to get my supplies and nice warm water to clean up that catheter and the surrounding area. Do you have any questions? Okay, I need to check your wristband. Very fine. I'll be right back, Marty. I'm washing my hands. You need 4 washcloths, 1 bath towel, 1 Chucks, you need a basin half full of 105-degree water. Marty, I'm going to take your cowbell away for just a few minutes while I'm washing you up. I'm going to provide privacy by closing the curtain. I'm going to lock the bed. Before I raise the bed, I'm going to go get 2 pairs of gloves. Marty, I'm going to raise your bed. The water is 105 degrees. I'm going to need 2 pair of gloves. I'm going to bring over my soiled linen hamper. You can use gloves or a paper barrier as long as you use a barrier and don't touch the hampers directly. because you've already washed your hands. Okay, I'm pulling the curtain closed around the bed. Okay, Marty, I'm going to raise your bed now. You'll feel the bed going up. This won't take very long. Marty, the first thing I'm going to do is just put a chucks underneath of you so we don't get your bed wet. I'll need you to lean over that way towards the wall for me. Can you do that? Can you turn away from me a little? I can help you. Okay, you can come back toward me now. Can you raise this leg just a little bit? And I'll pull the chuck out. I just want to make sure your bed doesn't get wet. Marty, I'm just going to put this towel over you to keep you warm. Can you spread your legs a little bit so we can wash up? Marty, let me know if you feel any discomfort, okay? Okay, Marty, I'm going to wash up now. I'm just going to go down to the catheter where it's inserted and wash around it like a backward C and go right down through the middle between the labia with the first side. Okay, I'm going to turn the washcloth over to the second soapy side, go down to the catheter, make the other C around it, and go right down through the center. All right, I'm going to open my washcloth, Marty, and wash the far labia, and then on side 4 I'm going to wash the near labia. We're going to do the same procedure except with the rinse. Is the water warm enough for you? Okay. It feels all right, the water? All right, good. So I'm going down to the catheter, I'm washing around it, halfway around, going right down through the center. Side 2, going down to the catheter, washing halfway around it. So we've washed completely around the catheter and go right down through the center. Open it up, side 3, I'm rinsing the far labia. Side 4, I'm rinsing the near labia. And I'm going to pat dry. Okay, I'm going to get rid of these gloves. So we clean the catheter tubing with basically clean water, clean gloves, and clean washcloth. Okay, I'm going to secure the catheter between my fingers so that we're not pulling on it. We don't want to make it tight or taut. And I'm going to wash 4 to 6 inches down the catheter tubing. I'm going to flip the washcloth over and wash on the other side 4 to 6 inches down while I'm holding tightly as close to the area where it is inserted into the body as possible. Okay, I'm going to do the same thing, except this time with no soap. I'm just going to rinse. I'm going to hold the catheter tubing as close to the urinary meatus as possible. Holding it tightly, I'm going to rinse down 4 to 6 inches, flip it over, and rinse 4 to 6 inches down. So we have washed and rinsed the catheter tubing. Using a separate part of the towel, I'm just going to pat dry the tubing. Okay, Marty, can you roll towards the wall and I'll get this chucks out. It's a good thing we had it here. We would have gotten the bed wet. The bed is nice and dry, I'm noticing. Straighten your leg out, Marty. Marty, I'm going to be right back to make sure that you're totally comfortable. I'm going to lower the height of your bed for right now, and I'll be back to make you comfortable. In the process of demonstrating the skill, I brought in an extra washcloth. We can't use it for anybody or anything else. It was clean when it went into the clean water. It was just an extra. So we've got to put that in this soil bedding hamper, even though it wasn't used. And waist and below goes in the toilet. Marty, how are you feeling? Are you all right? Do you feel nice and clean now? That's good. Marty, I'm just going to check your tubing, make sure you're not lying on it, it's not kinked. And it's dropping, the urine is dropping right into the bag, nice and straight. Marty, do you want to sit up for a while or do you want to stay lying down? You want to lie down? Okay. Can I get you anything? A drink of water? No? Okay. I'm going to open the curtains for right now, and then I need to disinfect. I had to lower her bed with gloves on that I used to do peri-care around the catheter tubing, so I'm going to give that a couple swipes. Marty, here's your call bell. You sure you don't want to sit up for a while and watch TV? No, you're just going to take a nap? Okay. Well, enjoy your nap, all right? All right, I'm going to pause. Take a look at Marty. I believe that I did everything that I was supposed to do. Check the tubing, it's not kinked, the bag isn't touching the floor, the bed is as low as it can go. I'm going to come over here, read my card. When I was cleaning Marty, I didn't notice any redness or anything unusual, any inflammation, nothing unusual around where the catheter is inserted, so there's nothing unusual I need to report to the nurse about the catheter insertion site. I am washing my hands, and I'm finished.